Hi, my name is Cynthia, and I'm a pharmacist at the transplant department at UC Irvine. And today I'm going to talk to you about medications after transplant. So let's get started. You recently got a new organ. Your body would know that organ does not belong to you, and if your body tries to attack it, it's called rejection, and that could damage the new organ. So we prevent this by giving you anti-rejection medications that are taken for the life of the new organ. After transplant, you'll be given a medication schedule to help you learn your new medications, and this is a sample here. So you can see the first column has the name of the medications. In the middle, you'll have what time to take your medications and how much. And the last column tells you what each medication does. So let's talk a little bit about these three medications listed here. They are the most common anti-rejection medications given after transplant. The first medication is called tacrolimus or Prograf, and I do recommend to patients that they know both names. Tacrolimus is a capsule and is taken in the morning and the evening. We do have to draw levels in the blood, and depending on the level, we may change your dose up and down, but we'll talk more about that on the next slide. The second medication is called mycophenolate or Myfortic, and mycophenolate is a tablet, and it's also taken in the morning and the evening. The third medication is prednisone, which is a tablet and is only taken in the morning. Prednisone is a steroid and can make some patients feel very awake. Therefore, we don't want you to take it at nighttime. But let's talk a little bit more about that first medication, tacrolimus or Prograf. We do need to measure levels in the blood to make sure that you're not receiving too much or too little of this medication. And depending on the level, we'll change your dose up and down. When you leave the hospital, you will have to come to the laboratory to get your blood drawn so that we may measure the level. On those days, make sure that you take your tacrolimus after the morning blood draw. As I mentioned, we will change your dose up and down depending on the level, so do expect many changes in the first few months. Tacrolimus also comes in different strengths, and it's very important that you do not mix up the different strengths. So now I want to talk about why it's very important that you don't forget to take your medications. As we talked about in the previous slides, we do have to measure levels in your blood, and because of that, it's very important that you take your medications on time. It's also very important that you don't stop your transplant medications without talking to your doctor. And some patients ask what to do about missing doses. If it's very soon after your dose was due, take your dose as soon as you remember. But if you find that you're missing your medications a lot, or very often you're taking your dose too late, make sure you talk to your doctor about it, as missing your doses can increase your risk of rejection. So now I want to talk about when to call the pharmacy and when to call the transplant office. But first, let's talk about when to call the pharmacy. You want to call the pharmacy for routine refills of your medications. It's important to call early to allow the pharmacy time to fill your medications, and we recommend at least a week before. This is also important because sometimes the pharmacy may need to contact your doctor for a new prescription, and that can take some time. You always want to be aware of how much medication you have remaining so that you do not run out. Patients often ask how to call the pharmacy for the refill. This is an example of a medication label at UC Irvine, and you can see that on the label there is a phone number to call for refills. Even if you are using a pharmacy not at UC Irvine, there should be a number on the label that you can call for refills. So let's talk about when to call the transplant office. Please call us if you are having a side effect from your medications, for example, diarrhea or stomach upset, and make sure that you call us before stopping the medication. It's also very important that you let your doctor know if you start a new medication. And that's because there are some medications and herbal supplements that can interact with your anti rejection medications and make them work not as well. If there's a time where you've completely run out of your medications or you have no medication supply, make sure you call us right away. I hope that you've enjoyed this presentation, and if you have questions, call us at the number listed here. Thank you.